Dr. Anthony Fauci, the White House chief medical advisor, speaking at a COVID-19 response team briefing just a week after revealing that he had tested positive for the virus. Fauci looked well during the virtual briefing on Thursday and credited his mid-COVID symptoms and rapid recovery to being fully vaccinated and getting 2 booster shots. "I'm feeling really fine," Fauci said, responding to a reporter's question about his COVID case. He described having made symptoms the previous week, testing positive, and feeling symptomatic for one day. He also completed a 5-day Paxlovid antiviral treatment regimen.
Thank you very much, Dr. Walensky. What I'd like to do over the next minute or two is to just underscore and answer preemptively some of the questions that Dr. Walensky and Dr. Jarr and I have received over the last few days since the announcement was made. Let's just take a very quick review of the questions that people ask. For example, parents ask, how did they come to this conclusion? What was the data that led to the approval and recommendation of these drugs? Well, as you know, of these vaccines, as you know, we have two in question, Moderna and Pfizer. Both of those have gone under extensive placebo-blinded control trials, which is the gold standard of determining efficacy and safety. If we go first to the Moderna trial, it involves 6,400 children and infants. The important point to emphasize is that this is a vaccine which is 2 doses, 4 weeks apart. Importantly, the immune responses that were elicited by the vaccines were comparable to those responses in younger adults and in adults that were receiving a higher dose that unequivocally in a clinical trial led to a clinical benefit. So even though this is mostly an immunological bridging study, the fact remains that it is highly correlated with a good clinical effect. What about the safety of the Moderna? When you do vaccines, one of the things you address is what's called reactogenicity, namely what's the immediate local or systemic effect. So in summary and very briefly, the reactogenicity of this vaccine was essentially the same, no better or worse than what we've seen with any of a number of childhood vaccines that we regularly administer to our children. There was no incidence of myocarditis or multi-system inflammatory syndrome of children. Very quickly moving on to the Pfizer, which was a bit different. It was in 3 doses. First dose is separated by 3 weeks, second dose by 8 weeks. Again, the bridging immunological situation indicated that the responses that were elicited by this vaccine was equivalent to the responses in other studies, including young adults and in adults, which were clearly associated with a beneficial clinical response. With regard to the safety data of Pfizer-BioNTech, the same thing. The reactogenicity, for example, fevers, pain at the site, were really quite comparable to what we've seen in vaccines that all of us have been administering to our children over years and years. The bottom line of all of this is that the FDA evaluation and analysis of the safety, effectiveness, and manufacturing data were very rigorously and comprehensively looked at to support the EUA. The known and potential benefits clearly outweigh the known and potential risks in this pediatric population. And we want to make sure you understand, parents, that prior to making the decision to authorize and recommend these vaccines, the FDA's and CDC's independent advisory committees, as you heard, were consulted and voted unanimously in support of the authorization and the recommendation. Therefore, we are all very enthusiastic about getting your children vaccinated with these now available products. Back to you, Dr. Jha.
Great. Thank you, Drs. Fauci and Walensky. Let's go ahead and go to questions, and I'm going to ask my colleague, Kevin.